So how does it feel? Well, as far as regular symptoms, you have some of the classics like nausea, vomiting, constipation. Rapid heart rate has been noticed, as well as an increase in blood pressure. You may notice that your urine appears darker or might even appear red. And can you think of anything more freaky than seeing red urine in the bowl? That would wake me up in the morning. More serious symptoms include things like confusion and hallucinations. AIP attacks can even affect the nerves that control your muscles, so you might notice muscle weakness or even muscle paralysis. And of course, there's always pain, isn't there? So, what kind of pain are we talking about? Well, severe pain. How severe? Pain that requires hospitalization and morphine, just for starters. Now, you might think I'm kidding, right? I'm not kidding. Some people have described the sensation as feeling like there is a superheated branding iron inside of their guts. Now, of course, you and I don't have any practical experience with having branding irons in our guts, so what could I relate this to? Okay, think back to the last time you really burned yourself good on something in the kitchen, like on a hot pan on the stove or a baking dish out of the oven, okay? I imagine that when you burned yourself, you yanked your hand away pretty quick, right? I mean, sure. Now, imagine if it wasn't your hand being burned. Imagine if someone who didn't like you very much strapped a 400-degree baking dish to your abdomen, and you couldn't pull away, you couldn't take it off, and it didn't ever really cool down. That's the kind of pain we're talking about. Now, if you're at home and any of this sounds familiar to you and you're thinking, hey, maybe I have this, there's a simple test you can do at home that will point you in the right direction. It's really easy. All you have to do is pee in a cup or a glass, whatever. It doesn't affect me which one you use. And then you take the urine outside into the sunlight. Maybe in a private area, patio or something, away from the eyes of prying neighbors. Just saying. Anyway, if the urine then darkens as a result of exposure to the sunlight, you might be onto something and you may want to talk to your doctor about AIP sooner rather than later. And if you know somebody who has acute intermittent porphyria, I would invite you to think back on the example of the superheated branding iron in the guts, and then extend that person all the compassion that you can muster, because their pain is great and their need for your compassion is likewise great. And that's all we have this week. Thank you so much for joining me.